Good morning and welcome to Rising. We've got a great show today. Robbie, what do we have?
Well, Team Rising is here with us to discuss the Biden administration's plan to freeze federal student loan payments yet again. And Newsweek deputy opinion editor and author Batya Ungar-Sargon discusses the viral Let's Go Brandon Joe Biden moment that happened during the NORAD Santa tracking service on Christmas Eve.
But first, it seems like everyone's holiday guest lists were ever-changing due to the spike in Omicron cases ahead of Christmas. And as family members and friends struggled to find at-home tests and book appointments, Vanity Fair reports that the administration initially dismissed an expansive plan to ramp up testing ahead of the holidays, and that the fixation on vaccinations alone left testing on the back burner.
According to the report, a group of COVID experts met virtually with the administration in late October and gave plans to specifically reduce transmission over the holidays, and suggested in a 10-page report that the White House offer rapid at-home tests for everyday Americans, adding up to 732 million tests per month. The White House then rejected this idea and instead moved rapid tests more swiftly through the FDA. Now they may be acting a little too late. According to ABC, next month the federal government is prepared to ship as many as 500 million at-home testing kits to any household that requests one, and will set up new testing sites nationwide.
Brianna Joy Gray highlighted the irony of Biden's interview after Biden told ABC that he thought about ordering 500 million at-home tests, quote, 2 months ago, though the blueprint the administration rejected would have sent out 732 million tests to safeguard holiday gatherings.
White House Press Secretary Jen Psaki admitted regret over her now viral response to a reporter that mocked the idea of sending at-home tests to all Americans. Let's watch that again.
Look at what we've done over the course of time. We've quadrupled the size of our testing plan. We've cut the cost significantly over the past few months. And this effort to ensure insurers you're able to get your tests refunded means 150 million Americans will be able to get free tests.
Complicated though. Why not just make them free and give them out and have them available everywhere?
Should we just send one to every American?
Maybe.
Then what happens if every American has one test? How much does that cost, and then what happens after that?
All I know is that other countries seem to be making them available in greater quantities for less money.
Well, I think we share the same objective, which is to make them less expensive and more accessible, right? Every country's going to do that differently.
The exchange came 2 weeks before the president decided to take that very route. So I don't know about you, Ryan. I had a very COVID positive Christmas. Many people, friends, family, coworkers. My wife actually tested positive.
And you burned through a couple of tests.
We did. We had tests on hand. They are not cheap. They cost about $20 for 2 tests. You get a set of 2. And I had to go to...
Which makes you calculate, like, how likely am I? How much is it worth
it's just
to
enough.
me right now?
And then you couldn't find it. I went to CVS. They were out. Walmart was out, or Walgreens, rather, and then a different place had them. We just tested. I've already had it. So we just tested because we'd seen a lot of people. We were going to see some more people. And my wife wasn't really feeling ill, but she tested positive. So we hightailed it back to D.C.
Because it's unusual. Those tests only detect within a certain amount of time. So she must have been just heading up.
So anyway, I agree. The tests are very key.
Because it prevented your wife then from going to that next event and from getting on a plane.
Exactly. But man, the administration has screwed this up. This is the biggest government failure of the pandemic. And look, the plan to send them to Americans, I don't know that the government needs to do that. They need to bring down the cost of it and have there be more of them in stores. And the simplest way to do that is to approve more tests.
Right.
And we have reporting from ProPublica, other places over and over again, that the FDA just dragged its foot, said this test isn't quite good enough, we don't want it. And it doesn't matter if it's good, we just need them, we need to flood the market. They don't need to be 100% accurate, they need to be pretty good. Pretty good is good enough, especially if they cost $1, you could take 5 tests.
Right.
2 tests is $20 right now.
Right.
What if it was a little less accurate, but it only cost $1? Well, you could take 1 million of them.
Right, because then if you get a positive, like your wife, then you can take a second one to test again.
Exactly.
Now the risk becomes somebody gets a positive and they're like, are you sure? And then they take another one, and they like Trump did. Trump did exactly that. They took a second one. They're like, oh, that one said
test
negative.
Until you're negative.
Yeah, so let's go with this one.
Well,
I like that one better.
That gets the point that testing is not gonna solve the.
But it helps.
But it does help.
Yeah, and what the Vanity Fair story makes clear, which we knew already, which was that a lot of the resistance from the FDA, from these bureaucrats, and from the Biden administration to pushing tests through the system was because they doubted that people would handle them responsibly. Yeah. Which is what the public health authorities have been doing this entire time. Couching,
you can't handle the truth.
Couching what they say to the people because they're worried about how people are going to respond to it. You know, if we tell you that this thing is going to help the pandemic, well, now all of a sudden they're not going to go. They're not going to go test. If they were any good at that, it'd be one thing, but they're not, because there aren't that many people who are strongly anti-vax but are testing all the time. There's some of those,
right?
But more often, the event is all the way on the other side, where there's no overlap, and the people are saying, "Look, this whole thing's a hoax. I'm just going to live my life. Everybody's going to get it, and if I get it, I get it. And you're even if you're vaccinated, you can spread it. So I don't care about the test." So withholding tests in order to get those people to get vaccinated makes no sense.
And honestly, even if it was not going to ultimately slow the pandemic down very much, but more widely available tests made it easier for people who are very COVID cautious to feel okay enjoying a little bit more of life, that would be a perfectly legitimate positive that the government doesn't need to stand in the way of. They just need to allow other scientists to develop these tests and market them. It just involves the government doing nothing. Right. And if the government doing nothing creates less harm, they should do nothing.
And the irony of that Jen Psaki comment is that she wasn't clearly, the administration, or at least the communications team, had no idea what the rest of the administration was up to, because they didn't come out with this 500 million thing because she got embarrassed. This was in the works for a very, very long time. The NIH has been running pilot programs in Nashville and some other places where they were sending 1 million plus tests to the community, to churches and other places, getting them out, and then testing whether or not they do a control neighborhood and a neighborhood that would be flooded with tests to test whether or not this was actually reducing the spread. So and they weren't just doing it nationally; they were doing it they had tens of millions of tests that they were sending out, sending to people's homes basically. Doing the exact same thing that Psaki was mocking. Right. What do you want us to do? The thing that the NIH is doing? That'd be crazy. Well, hey, every agency has its own. NIH might do it this way. We want to do it this way. Even Dr. Fauci admitted incompetence on testing, telling ABC News that we've obviously got to do better, saying that things will improve as we get into January, possibly from the mass number of cases we have now that will die down and grant some immunity to communities affected. I mean, there's certainly that hope that now you're having, and the other thing that the administration miscalculated was the efficacy of the vaccine, and they didn't predict an Omicron coming through that could break through as easily as it is.
Yeah, the vaccine is, we have to face facts. It is not, it's probably reducing transmission at least a little bit, because it lessens the period in which you're symptomatic, and it is symptomatic people are more likely to spread, or more easily spreading the virus, but let's not, we can face facts. A lot of people who've been vaccinated are getting it. It is not just a general blanket of protection the way it was for the original strain. Yeah. Now, you should still be vaccinated because why not be sick for fewer days rather than more days? And also, in the event you're going to have severe disease, it is still standing up well to that. But it is not just, vaccines are not, we're going to have cases, people are going to get this thing. It is insanely contagious. Yeah. Maybe this wave is, so high, the peak is so high. I'm going to talk about this a little bit more on my radar. Yeah, we might burn through it, I think, more rapidly than we did.
South Africa's already on the downswing. The stats I saw were something like if you were double vaxxed, then you were 4 times less likely to get it than if you weren't vaccinated at all. And if you were boosted, you're 20 times less likely to get it. But with hundreds of thousands of people catching it, that's still thousands of breakthrough cases a day. Right. But they are also finding that the vaccine is helping, keep you out of the hospital and keep you from dying. But all of that focus on the vaccine prevented them from doing what should have been easy. And the other thing that the Vanity Fair article pointed out is that one administration official explained that the reason they didn't adopt this at the time was that they didn't have the manufacturing capacity to do it. But instead of then ramping up the manufacturing capacity, they're like, well, I guess we don't have the capacity to do this.
It'll be fine. What could go wrong? What could go wrong?
Like, I'm sure by the time we ramp up capacity by like to January, this pandemic will be over. So don't worry about it.
Yeah, betting that it'll be over by this date, so we don't need to do anything.
Right.
Hasn't worked out yet. One of these times it will be over.
Just do it.
But
just do it.
Not yet.
Yeah. Once we kill it here, then export it.
Yeah.
Anyway, we will tell you what's on our radars up next.